Everybody, it's Dr. Vinay again. You probably just left my office or got off a Zoom call with me, and you're probably confused. And you're wondering if I'm confused or if everyone else is confused, and you just got this sheet, which is also confusing. And that's because there is no such thing as a standard FOE procedure in my office. Everyone's procedure is a little bit different, and I build procedures to your specific need and the resources you have. So this sheet right here is going to walk us through step by step on how to design the procedure that's best for you, or from your graft count to what kind of extraction technique you use, and if there's any other things you need to add to it for your specific case. So let's get started with that and see if we can clear up this confusion and create the best procedure you've ever heard of. Today we're going to walk through this little quote sheet that I gave you. We're actually going to design your procedure such that it's kind of customized towards you. So let's kind of get started on what this is. I want to talk to you about standard procedures. As you go out to other clinics, you're going to get a very clear-cut answer on the number of grafts you're supposed to have and the cost of your procedure. This is great. I started out doing procedures in that way as well, just giving people, hey, this is what will work. But over time, I realized there's a lot of shortcomings to a standard FOE, and it really is on a case-by-case basis where you can achieve better results. So we test a lot of techniques, we developed a lot of techniques, and in certain scenarios, these techniques are something we would recommend. In some of these cases, we develop techniques that are so important that we recommend them in all cases, but you can decide for yourself what you want. Standard techniques, the way you want to go, that's great. If you want to try micro and all the bells and whistles, that's great also. I love those cases, and at some point in my career, I'll probably just do those alone. So as we go through the sheet, you'll see that there's two sections. There is a core procedure, and there's additional recommendations. The core procedure is meant for everybody. These are the most important things. Their graft count and the technique of extraction. They're going to determine the number and health of the grafts we have to achieve our final result. So in number of importance, the graft count is way more important than the standard versus micro extraction. We'll go into why that is right now. So a graft count is really important because it's the number of hairs or the number of grafts that we have to achieve a result. There's about 2 to 2.5 grafts on average per person that goes in. So if you get 2,000 grafts, you're actually getting 4,000 hairs. And the number of hairs we have helps us accomplish your goal. Either how much area we're going to cover, how much density we're going to be able to achieve. And there's certain things that will kick up your graft count that are very important to know. The first thing being the amount of area that we have to cover. Obviously, there's more area that we have to cover. We're going to get a higher graft count. The second thing is working on a hairline versus the top of the head and the crown. The hairline has to be created with single hair grafts, grafts that have 1 hair per graft, not the 2 to 2.5 average I just told you. We want nice feathering in the front hairline. And by definition, those grafts are 2 to 2.5 times less as dense as the average graft. It means we're going to need more grafts to do those. In fact, it's about 200 grafts per millimeter on the hairline. You're going to want about 5 to 10 millimeters of that softening before you get into double hair grafts to make sure that hairline looks natural. The second or third reason for more grafts is just the thickness of your hairs, right? People who have thicker hairs are allowed to have more donor density, not just donor number, to cover, to give us greater coverage or more density in the area. So if you have nice thick hairs, your graft counts will be lower than someone who has not as nice thin hairs for the restoration. Another factor is the color of hairs. If you have dark hairs and light skin, we call high contrast hairs, you're going to be able to find out that it's easier to see through your hairs into your scalp. And for this reason, we're going to want more hairs to achieve some density. So someone who has dark hairs, thin hairs, and is doing the hairline, you're set up for more grafts. Lastly is hair texture. Curly hairs cover more area than your typical straight, silky hair, smooth grafts. You're going to need less grafts necessary, but someone with thin, straighter hairs is going to need more grafts. All right, so what do you get out when you go get a hair restoration consult? You're going to get a standard graft count. And that graft count may be based upon one more important factor, which I've not covered yet. It's whether they're doing a dry correction, a wet correction, or a foundational correction. These are terms I came up with myself. When your hair is dry, it obviously shows some amount of hair loss. My hair looks like this dry. However, when I get it wet, you can see a lot more hair loss that kind of develops back into these two valleys and then a little bit on the top. So a dry correction is one in which we try to create the visual effect when the hair is dry. And a wet correction is what we try to do to correct the visual effect totally when it's wet. A foundational correction is when we try to correct everything that we possibly can in one procedure. And usually that's the front hairline, up to the crown, down the two sides, such that when everything recedes in the future, it looks normal, not just when it's wet, but all the time. Now, foundational corrections may not be possible for everybody because we might have hairs that are too thick along the sides to really graft into them. But what you'll see here on the paper is that you have two graft numbers, a minimum graft count and an optimal graft count. That minimal graft count is a dry correction, may or may not taking into account all the factors such as donor density, hair thickness, hair color, texture. It's just we're trying to do to correct the area, and that's going to be your lowest graft count you can possibly have. So a front hairline, maybe 2,000 grafts. And then there's the optimal graft count. This is taking every single factor into account, how thick your donor hairs are, the color your donor hairs are, the texture, correcting not only dry, but maybe wet and foundational, depending on what I tell you can achieve. This is going to be your optimal graft count. It's obviously going to be higher. Well, you're wondering why someone would obviously give you the optimal graft count. It's more grafts. It's going to be much more profit for a hair restoration company. Well, there is an operational ability here that needs to be achieved. If you're a clinic that's doing more than one case per day, it's going to really be hard to give your patients anything more than 2,500 grafts each. Otherwise, you're going to be taking an entire day to do one case and not be able to focus on the other. The second thing is, if you're running more of a technical-oriented team with just one other person, you may not have the manpower to actually get all these grafts done. But in our clinic, we really dedicated the idea we can do foundational corrections, and getting up to 4,500 or 5,000 grafts in a day is not a problem. So those are the two different graft counts. Now, lastly, I tell people you want to do the largest correction you can that's appropriate, like clinically appropriate for your future. You don't want to use grafts you don't want to do, but you should do a large procedure as you possibly can. Why is that? There's one more factor, and this is actually runs into your second procedure that you may have. In your first procedure, all you have is skin and hair in the back of your head. Hair is hard, skin is soft on most occasions, unless hair is really thin. It's easy to get those hairs out. However, in your second procedure, no matter how big or small your first procedure was, it's skin, hair, and scar. And, skin can really scar can really mess up a procedure. The scar can encapsulate the hair next door, causing the tract to get stuck such that the hair fractures when it gets out. It can strangulate the follicle, making it a weak follicle when it comes out, or the blood supply, making it's hard to integrate because the new blood supply won't be able to get in. So it's better off to correct everything in one procedure if you can. And I'll build this all into your optimal graft count. But here, you can still go with minimal graft count, get a standard procedure. So graft count, you can see how important that is and how complex it is to come up with that number. That's why I give you two. I don't stick to one and not give you an explanation, but you can choose between those two or somewhere in between. Okay, standard versus micro FUE. This is choice number 2, and it is actually a very important choice. We just talked about graft number, and now we're talking about graft health. In a standard FUE, the technique uses a cylindrical blade that has a sharp cutting edge. This blade goes down the hair shaft to try to get the follicle. It cuts everything in its path, and sometimes it cuts the hair, leading to what we call a transection, and that can happen 10 to 15% of the time where you actually try to get a hair follicle out, but you actually miss it because you cut across the hair shaft itself. Now, there's other things like the oil gland, very important for lubrication of the hairs, keeping the hair silky smooth. That can also be transected as well. And that's why we kind of adopted the technique called micro, minimally invasive collection by reticular oscillation. This is a term we came up with. And it's also PUE, pilosebaceous unit extraction, which means we're grabbing not only the hair follicle, but the oil gland as well. That's also a trademark term we have. But what is this? It's the device called Trevolini. I would say about 60 to 100 people in the world have it right now. We're all in a text chain. We talk about the device. There's not that many, but it has a setting called reticular oscillation, which we adopted. And instead of having a sharp spinning blade that can not only heat up and hurt the hairs on the way in, it just oscillates. And it slowly gets that hair out as it's going down the shaft. There are also multiple different kinds of tips. You no longer have just a sharp cutting blade. You have blades that are flared out such that the tip never touches the hair shaft that's going in. You have ones that have a notch that allow it to spin and cut the outer edge of the skin and then turn into more vibration mode going in, causing no cutting. You have not just reticular oscillation, but other modes, vibration, oscillation, mamba, and there's a couple others. And you also have all different kinds of tips like we just discussed and speeds. So what does this lead to? Pretty much infinite settings that allows us to get the hairs out in the best manner for you, such that if your skin is very soft, we don't accidentally dive into it too fast. We have a setting for that. If the outside of your skin is too hard, we're able to cut through it. Sorry, that's the last setting of that thing. It's rotation, oscillation, mamba, and it can do cutting like a normal machine. So infinite settings allows for us to extract the grafts in a way that's healthiest to you. We're no longer just stuck to one setting. We can actually do things in a very kind of bespoke or customized way. This leads to healthier grafts. It also leads to less transections. It's no longer 10 to 15%. I've only seen about a 2% transection rate with micro, which means that if you need a lot of grafts, then 10% more are going to survive just because you did micro lead to higher graft count, not them just being healthy. These healthier hairs are also hardier. So when you place them in the recipient site where we're trying to do the hair restoration, they tend to be less affected by the scar. Scarring can cause kinking and drying of the hairs, and nice, hardier, thicker grafts have more resistance to that. That's why probably the micro results look more natural. So you got graft count, you have micro. That's your core procedure. How many grafts you need to get, how healthy these grafts going to be. That is going to be the main things that we're going for in determining your procedure. Now, after that, we have all these additional recommendations. These additional recommendations, sometimes they're helpful in everybody, and sometimes they're helpful in specific scenarios. The first one, as you can see, a discrete haircut is obviously something that is your personal choice. When we do these procedures, we only buzz down the sides and the back. We have a barber doing it, so it looks good. We keep the top at its full length. In a discrete procedure, there are all different ways to not do the haircut on the sides. Either we leave a totality and then we go get individual hairs one at a time, or we can flip up the hair a little bit, grab hairs underneath it, and do something called a no shave. Or if you have really long hair, we can just buzz a little strip that you'll never see because it'll be hiding underneath the hairs on top of it. There are discrete procedures. Those take more time, a little bit more effort. What they do is they drop the number of grafts we can do. But you can see that is an option if you really want a discrete haircut. It's something we can do. Something I love to do. I can tell you that there's one time that I will not do it, and that's if you're getting your front hairline done. And that's because I want to see the hairs as they're coming out of the scalp to pick those nice single hair, soft looking grafts to make a nice hairline. If we're just kind of moving hairs out of the way and just getting a graft, that's just like working through a forest. It just doesn't work. We don't want to sacrifice your long-term results for 10 days of haircut. And I won't do that. So I will tell you if a discrete haircut is something that is amenable for you. And if you want it, you can go for it. All right, next one is sequential extraction. This is something that applies to standard FUE only, not to micro. Because micro, it is already built in the technique itself. So what is sequential extraction? Well, a lot of people brag about using the smallest tip they possibly can to remove the hairs. Well, let me tell you this. We don't want to remove the hairs. We want to remove the follicle. And the tissue around the follicle is essential for that hair to be reintegrated with the recipient site where we're doing the hair restoration. If it is not there, if you strip too much of that tissue away, that hair will not take. It will look weak, or it can be affected by scarring, causing it to kink or be dry. So you actually want the right amount of tissue for the hair. Another mistake people make is saying that they use the same tip size all the way across the scalp. So the same tip to get a single hair graft, which is relatively small, the same tip to get a double hair graft, triple hair graft, quadruple hair graft. That quadruple hair graft will be totally stripped of its tissue if you use a single hair graft size tip to get out. So what does sequential extraction do? Well, we start with the smallest hairs we want to get, the ones we want to restore the hairline. We get them first with the appropriate size tip that's as small as it can be to result in a nice healthy hair. Then we move on to double hair grafts with the bigger tip, and a triple hair graft, and then a quadruple hair graft. We're actually doing 4 passes do this procedure instead of one. It leads to just a healthier graft. Now in micro, remember, we're using vibration, oscillation, mamba, and cutting only in certain scenarios. We're actually removing the hair unit as it lives itself. That means that the hair unit tends to be great no matter what we do. That little cut we make on the top of the skin with a small tip or big tip is pretty much irrelative to the hair graft that comes out. So you don't need to do this with micro. It's already kind of built into it. Okay, now you'll see 4 different ACS techniques that we can employ, right? For pre, intra, post, and then for the other areas. So what's ACS? This is autologous conditioned serum. This is what we call medical grade PRP. It's something we adopted from the orthopedic community. Essentially, there are cells in your blood, not just platelets, but also monocytes and neutrophils that are involved in the wound healing process. In order to heal a wound, your body has to do a couple things, and these cells secrete the growth factors to make it possible. So, new blood vessel growth. There's a growth factor called VEGF to have new blood vessels grow in. New collagen deposition. This is what actually wounds are strengthened by. And then hair and skin cell replication. There's EGF that helps with promoting growth of the hair and skin cells. Well, why do we do this in a hair transplantation? Well, it helps with blood flow. It helps lay down collagen for the healing, and it helps stimulate hair and skin cells. These are things that we can utilize in different parts of the procedure for different scenarios, different people. So, pre-procedure ACS in the recipient area. Why would we do this? Why would we want to rev up the blood supply, the collagen deposition, and the hair and skin cell replication? Well, soon as those grafts are put into that area, we want them to integrate as fast as possible. Now, this can be advantageous in everybody, but there's a couple scenarios where it actually is something we should probably do to lead to better results in scenarios that aren't as favorable. This is someone who's had a previous procedure. If you had a previous procedure, you don't have normal skin where the recipient side is. You also have scarring up there. And in that scarring, your blood vessels are no longer normal. They are encased in scar. They're no longer pulsatile. They can become like tubes. And what we want to do is really rev up the blood supply in those areas. So someone who has scarring, someone who has mature skin, someone who has sun damaged skin, or someone who had another reason to have a scar up there, or something else that can affect the recipient bed. If we feel like we should rev up the bed, a pre-procedure ACS is probably something I'll recommend. For everyone else, yes, if that's something you want to do to optimize your results, that's good. But I'm really going to recommend it people in those scenarios. And maybe if there's something that I didn't mention, I'll tell you about during your consultation. Okay, intra-procedure ACS. You've probably been to a lot of clinics. They say they're going to throw in some PRP. That PRP is going to help you grow your hair. Well, it's really hard to believe that in a hair transplantation, that one single session of ACS is going to help regrow your hair. Studies show that it can help hair growth come back faster, not necessarily by number. So we can do it for that benefit. However, there's also other things. A lot of people talking about how to preserve your hairs while they are outside the body. There's different solutions, hypothermosol, ATP. Well, what better way to preserve your hair grafts than to use your own body's plasma? When we're doing ACS therapy, we get something called PPP with it, platelet poor plasma, and we can use this to preserve your hairs. So we'll do an ACS session in the recipient bed, like other people are talking about. It leads to faster regrowth. We'll preserve your hairs in the PPP, the plasma component. So who should do this? Well, if you're having a large graft procedure, your hairs are outside the body for a longer period of time, this may be the way to preserve your grafts such that they're no longer in an artificial solution for a long period of time. They have more metabolic support because it's the way your body supported them in the first place. We will get the additional benefit of faster regrowth, but I'll probably make the recommendation if I feel like those two are particular scenarios in your case. Secondly, if you had those things before, mature skin, scarring in the recipient site for a procedure previously or something else, or sun damaged skin, we'll probably want to do a second ACS session during your procedure because 2 will be better than 1 to, again, help promote reintegration of these hair grafts as soon as possible. So, all right, post-procedure ACS. This is actually probably my favorite, and it's, I don't know exactly why it's leading to such great benefit, because post-procedure, we do it after we start seeing hair growth, which means that the hairs are likely to grow. However, when I started doing ACS two times after the hair growth period, 6 weeks apart, I've noticed much fuller hairs. I've noticed the hairs are growing faster. I've noticed the hairs haven't been so kinked and dry. And the reason it could be is because right when the hairs are ready to grow, we're slamming them with growth factors, not the growth factors for blood supply, but more growth factors for hair and skin cell replication. That may allow these hairs to kind of bust through scarring and lead to faster regrowth. Maybe that has resulted in the greater output. Now, this is so weird because I'm giving you a lot of evidence for pre-procedure, intra-procedure, but I am saying that post-procedure, this is where I see the greatest benefit. And we're probably one of the few groups that's really pushing this. I do 2 sessions afterwards, and I've seen much greater growth. And I encourage almost everybody to do this, because I have not seen a reason not to do it. Your hair is just going to need natural support, and maybe they just need a little bit of a jump start after procedure, but really great results with that. And that also leads into doing additional sessions of ACS, not in the area of your hair transplantation, but in areas outside of it. Now, remember, hair transplantation only addresses the areas where we worked, but there could be other parts of your scalp that are already thinned out or also exhibiting progressive loss. Well, if you're doing an ACS session for your transplant hairs, I will extend that to the other areas where your hairs can benefit, into areas where you haven't had a transplant. If you do 2 more of those sessions, you'll actually complete what we call the hair optimization process. This is going to boost all your hairs to the maximal thickness. And again, I can't speak highly enough for doing 2 to 4 sessions of ACS post your procedure to optimize your results. So there's 2 sessions for the area of your hair restoration, usually the front, and 4 sessions for the area where you have not done a hair transplant. But we will, if you decide to do those 2 sessions during your or doing it in the area of your hair transplant, we'll just charge you for an extra kit. I'll just do it for you. We'll just cover the supply cost in it to help decrease your cost and to get a better result all over your scalp. Now, if I told you early on that, you want to correct your entire scalp, and I probably told you to do these ACS sessions. So I will always recommend that for someone who's trying to go in for a full scalp restoration or improving the health of their full scalp, not just the area of the transplant. So there you go. That's ACS post-procedure. Okay, so review. The first thing you look at is your graft count. You're going to hear a minimal graft count. That's going to correct the dry area. You can hear an optimal graft count that will give you a wet or full foundational restoration. This is the most important thing to get the results you want. Second, we have the health of the grafts, standard FUE versus micro FUE, micro resulting in a healthier, hardier graft for better overall results. And then your additional recommendations. Do you want a discrete haircut? Should we do sequential extraction because you're getting hairline done? Should we prep your skin bed because it might be damaged to accept hairs? Should we support your hairs in the procedure as well as promote early growth? And should we do post-procedure ACS to really optimize the results and to start treating areas outside the transplant? So hopefully it's not too confusing. Go ahead and build the procedure you like. Once you're done building the procedure you like, you can shoot me a text or reach out to the office to get your final pricing. Still a little confused here. You should just text me so we can talk through it.